Good morning guys, and welcome back to my channel. My name is Krizia Ann and I am a West Coast University student, and I make videos for nursing students, current nursing students, or future nursing students. I don't know why I'm actually have this much energy, but it is Monday, November 2nd, 5:58 a.m. I haven't slept. I literally have not slept. I woke up at 3 p.m. yesterday. And my sleeping schedule has been messed up. It's week 10. I ended critical care term, and today is the very first day of the start of my integrations term. Oh my god, I literally have just a couple more months left until I'm done with school. But in today's video, I'm going to be taking you guys through my first week of integrations. I have a lot of things going on today. So if you guys want to find out what you should be expecting on your week 1 of integrations, or also known as nursing 493, then continue watching, and don't forget to hit subscribe and put a thumbs up button if you like these kinds of videos. Alright, so before I begin, I just want to go about like what today's plan is. So today I have scheduled from 7 to 9 a.m. I have a mandatory nursing 498L for my clinicals, a mandatory orientation with one of the professors. I think they're basically just going to go over the expectations of everything that is going to go on with clinicals and the hours that you need, and I don't know what else information they're going to give. So that's from 7 to 9, and then at 10 o'clock I have, oh shoot, my alarm. Then at 9 o'clock I have a career services, let me turn off my alarms. At 9 o'clock I have my career services presentation, or NCLEX presentation or something like that. And then at 11 o'clock I have to go to the hospital that I'm going to be doing my clinicals at to do an orientation. And then I have lecture from 1 to 6. So literally this whole entire day I'm packed. I don't think I have clinicals tomorrow. I have my clinicals scheduled on Tuesdays. So week 1 on your integrations, you do not have clinicals. You just expect to have a clinical orientation depending on whatever day that they have it all scheduled. So that is what I'm going to do. So I will see you guys at 7 o'clock for my Zoom meeting for my orientation. So this is how I'm gonna have my setup for today. So they got the nice back wall, so it looks, you know, professional. Yeah, so that's how it's gonna look for today. One of the things too, you have to have this blue folder that you have with you. Like, what is this? Ooh, I should keep that. This blue folder with you. It's basically your clinical folder that you have to have with you all times, because hospitals require all of this for clinicals. It's like your background checks, drug screens, immunizations, like all this paperwork that you always have to have on you when you're at your clinicals. So you're never gonna lose this. I literally have this folder from the beginning. So this is what you're gonna want to have with you every time you go to clinicals. And also it's important to have this on your very first day of clinicals, because your professor checks on it, makes sure that everything's up to date. It's just a requirement that you always need to have on you every time you go to clinicals, especially on the first day, because that's when your professor checks. Okay, it is 6:56. I did my hair, put my hair back like I was supposed to, and I have my top, but I don't have my bottoms on, obviously. But I'm gonna be starting soon. Oh my god, I hope I'm muted. Okay, I'm muted. Gonna be starting soon. There's a lot of people in my class right now. I think there's like 8 sections in this one, so we'll see. I'm starting to get tired, but I have the whole day ahead of me, so let's get ready to start. Got some music going on. Okay, just like how we always do, mobile attendance when, oh wait, what? I'm so confused. What? It's supposed to show a mobile attendance time. Interesting. Oh, that's for a different section. I'm so confused. So there was a couple of issues with attendance. So I'm gonna have to figure, well, that's gonna be fixed out later. Oh, we just started. Oh my god. Okay. Oh, that was 2 hours of straight up just information that you need to know. A lot of information. What I just learned is that clinicals for integrations is not like any of the clinicals we've had before, so it's completely new. So for integration clinicals or N498 clinicals, we spend majority of our time from the past clinicals, majority of the time shadowing our nurses, and what they expect for this time around is that we're gonna actually be precepting, meaning that we're gonna be doing majority of everything. So we have to act like we're the nurse, doing the assessments, teaching patients, discharging patients, charting, administering meds, everything that a nurse does. What they expect you to do, knowing how to manage your patients is what you're going to be doing on the floor in integrations, which is completely different. You don't have any concept maps, but you do have a lot of different assignments that I've never done during clinicals, which is the knowledge assessments or knowledge checks, self-evaluations, a lot of stuff. It's going to take me a little bit, like a day or two, to kind of just take it all in and understand exactly what I'm supposed to be doing. But now on to our 9 to 10 o'clock career services and graduate panel. So for this one, it's actually not mandatory, but they do highly encourage you to go because they're going to tell you like how you could basically get a job. So that is what is next. I'll probably go over all this stuff like later on in the week. There's just a lot of things that you have to do. It's just, I think the fact that it's like all different stuff and it's not what I'm used to in clinicals, and the fact that like I'm actually going to be on clinicals after like since March or April, the last time I was on the floor, it's just a lot. It's a lot. So we're going to see. We're just going to figure it out, and I don't know how I feel, but it's all overwhelming right now, as you can tell. I have my clinical orientation today, so I need to eat something before my stomach starts grumbling in the middle of like my professor talking. What is up, guys? I am back. I didn't want to take my camera with me to clinicals, but I had my orientation. It was at 11 o'clock till like 12:45. I actually wasn't even done yet, but I had to leave early because I have class at 1. But some of your clinical sites require you to go to the site to do some certain type of paperwork and things like that, and also to get badges, because in order to get in some of the hospitals you need a badge to get in. And so I went there, I got my badge. I had to get training on their point of care testing, which is basically how to use their glucose monitors to check the blood sugar, how to clean it, how to actually use it. We got our badges to scan to use those. And then we just kind of had our introductions with our professor and just talked about our expectations, things to do, like planning everything out for the rest of the week. Sorry, I'm like setting up my class right now because I have class at 1 and it's 12:56, and I'm hoping my webcam works because it's gonna be annoying if it doesn't work. I hate it when my math doesn't work. Ever since it's been online, I've just been having so many issues with this stupid computer. So since this is not working, okay, I need to stop this and figure this out. Oops. I'm so dumb. I had the wrong thing plugged in. I had the mouse plugged in, but I didn't have the webcam plugged in. But so we did an orientation and all that stuff, all the important stuff. Had to rush back, so literally this whole day I'm just jam-packed with so many things. But at least I don't have clinicals tomorrow, which I normally would, and I'm kind of free for the rest of the week to do all of the assignments that I have to do. So I'm gonna start class soon. Gonna do more introductions. I don't know why. There's like 70 of us and they want us to do introductions. So I think that's what we're gonna do, which is gonna take so long, and then we're gonna go over the syllabus and things to expect. And so I'm not excited for this. All right, see you guys later.
Next class, right?
I'm so lost right
now. That is
now.
next Monday.
Oh my gosh.
So you come, you do
so
that before
lost.
Sunday. Or Sunday by that you must turn in the assignment after the due date. That means
point.
only for emergency purposes.
If we miss
But
one
if
point,
you, it's not like any other
pass
courses
the
that you've
course.
taken so far.
If you miss here, you complete at 0 and you're not completing the full 90 class. Even one assignment. So you have to be careful with this one. Because
All right. Okay. So what happened was I was so overwhelmed with like so many things that I had to do that I didn't want to like record the next day, so I waited until a couple days, which today it's Sunday. Almost been a week since you guys saw me. But the reason why I wanted to take a week off was because the reason why I wanted to get back and talk to you guys about like what to expect is because I needed literally like 5 days to process exactly what needs to be done and to make sure that everything that I've done for the first week is correct. It's just so different compared to every other term that I've had, that everything that I'm doing is so new and it's just confusing and there's so many places to look for information and it's just a lot of stuff. So after that I went to Target and I bought myself like this weekly planner, just this weekly planner like to fill out to see exactly what needs to be done. So I'm gonna be separating like the work that's expected for each class. So technically right now you have 3 different classes, which you normally would always have. So you have your lecture, which is my N493, then I have my clinical rotation, which is my N498L, and then I have my capstone, which is N497. Let's just start with the easiest stuff. So with capstone, it's basically just preparing you to create your portfolio, to create your cover letter, to get your references and all this stuff, just to create a portfolio so when you graduate you already have your portfolio and everything and you'll be ready to apply for jobs. And that would just require the same thing that you do with all online classes, which is every single Wednesday you will have a discussion due by 11:59 p.m. and then you would have to respond to your peers twice throughout the week. And in addition to that, you have to do ATI modules and a couple of other assignments that are due every Sunday for that week. That's capstone. It's just similar to every other online class that you've taken. Now, when it comes to your lecture, so this is your N497. So integrations is also known as preceptorship, and you guys saw that if you miss 1 point, so it's basically like 21 points, and if you miss 1 point, it's basically like you fail the class because you have to meet every single requirement. So what that means is that there's 3 points that you normally get every single week. And this consists of a pre-assessment, a content assessment, and a post-assessment. And so on ATI, we're going to get an assignment, and every single week you have to do the pre-assessment, which is on ATI. And it's basically like you just take this test to see how you're doing. And then in class, that's 1 point. And then in class, you take a content assessment, which is a proctored test to see where you stand in fundamentals or whatever concept or subject you're doing that week. And so every single week we're basically retaking every single class that we took. So you're going to be taking a proctored exam for fundamentals, one for OB, one for peds, one for med-surg, one for pharmacology. And what this whole entire class is basically preparing you for your exit exam as well as preparing you for the NCLEX. So it's a pass, no pass class. All the classes this term are pass, no pass. And in order to pass the class, you need to pass the exit exam. And then if you don't pass you have to pass the exit exam with getting at least a 70% or above, or 73% or above. And then if you don't get that 73% and above, then you would, in order to pass the class, you would have had to pass your pharmacology test. So there's a couple ways to pass the class. And the reason why it's so stressful is because it's just like they want you in your A game. They want to make sure that you're submitting everything. So that is what to expect for your N497. You would always expect to get 1 point. You always have to do the pre-assessment the night before the test. You're going to take an exam on the day of your lecture. And then after that exam, you're going to have to do a post-assessment to see, actually, I don't know. I haven't even done yet, so I don't even know what to expect. So those are 3 points times that by 7 weeks, and it's 21 points. and I haven't had a full lecture yet because the first one is basically just an introduction. And actually the first week, like, I didn't even know I was gonna have an exam. I had a proctored assessment just to see exactly where we stand, and so that was that. In addition to that, in addition to these pre-assessment, post-assessment, content assessment things that you have to submit, there's something that you have to do weekly as well, which is your ATI assignments. So they will give you a list of exactly which ATI modules you have to do to complete to prepare you for the fundamentals, or like to kind of review. And that, I would say, would be around maybe 500 questions. And there's other optional questions that you could do that they give you to practice. And so then you would have to review the concepts that you didn't do good in. And that's basically what that is throughout the week. It's not very, this time they're not really teaching you anything. It's really up to you and to self-motivate. And it's a lot of self-motivating because you have to study on your own, and it's a lot of it's catered to what you need to study. So that's the thing about with the ATI. It's going to see what you're not doing good in, what you're doing good in, and then what you should focus on. And each individual student, like how much work you have depends on how much you have to review. And so that's what the weekly assignments are. And then you would have to submit on their Blackboard all of these ATI assignments that you had to do throughout the week. So that is for your N497 class. Just to summarize it, you have to do a pre-assessment before you take your test. In class, you have your content assessment. Then after class, you have to take that post-assessment. And that's very important. And in addition to that, every single week, you're going to get assigned ATI modules that you have to do, which is just practice questions that you have to practice on to prepare you for the next week's quiz. So this week, I did a whole bunch of fundamentals questions. And then tomorrow, in lecture from 1 to 6, I'm going to be taking a proctored test on ATI that will test me on the fundamentals to see where I stand with that. Now, then it gets to the tricky part, which is your N498 lecture. So, this one was different. For your N498, your clinicals, you do not have weekly, You do not have weekly, you don't have any concept maps. You don't have nursing process worksheets that I'm aware of. What you need to do though is that every single week you have something called a knowledge assignment, and it contains a certain topic. So this week it was just getting started, and then week 2 is about communication. And so my assignments are due. I'm not sure if everyone's assignments are due, but mine are due every single Saturday. And in the first week, you also have to do your med math exam. You have to do a pre-assessment test just to see like where you stand. How do you feel about your skills, your nursing skills, like things that you've learned throughout school, like how comfortable are you with what you've learned, and how can you apply that in your clinical lecture. And so weekly you have this thing called your knowledge assignments that you have to make and submit. And basically it's just like a small 5-paragraph mini essay talking about like the topic and how you can incorporate that into your practice. I haven't really gone over a lot of stuff, but the first one was just talking about professional skills and how I feel about myself, my developmental process of how what I've learned throughout the past 2 years as a student, and what skills do I feel strong in, and what skills do I feel weak in, that kind of stuff, just like self-reflecting kind of stuff. And then your professor is going to comment on it, and you're going to discuss, at the during post-conference or during conference when you're at clinicals, to talk about like, what did you find out in your answer. And the goal of this is to basically just create objectives. There's something that you also have to fill out, which is a clinical log and a clinical assignment. And every single week you just have to track all of your assignments and what you did. You also have to track what objectives you have at clinicals. What's your objective that day. For example, one of the objectives would be like learning how to do a pressure ulcer using the Braden scale test, or Braden scale, to see what's the risk of this patient. What is the risk of this patient getting a pressure ulcer? Those kinds of things, or knowing how to do your physical assessment. That is your goal for that day. So going into that day, your goal is to do a complete assessment, or admit a patient, or discharge a patient. And that's what you have to do to prepare for your clinicals. Now they're kind of making you think like, okay, they're actually like trying to make you prepare in being a nurse. It's no more shadowing. It's actually like a preceptorship. And if you guys don't know what a preceptorship, it's basically when you get hired into a hospital, you get a preceptor, meaning a nurse that you follow around, that they teach you, or they basically overlook at what you're doing. And this time it's not like you following them, it's you actually practicing nursing, and then they're overseeing like your work and what you're doing. If you have any questions, you would ask them. It's not like you're a student anymore just watching to see what they're doing. You're actually hands-on, trying to manage 4 patients on your own, administering medications on your patient with your patients, that kind of stuff. So it's a lot. I really like my professor because my friend had him last term and he really pushes you to be a nurse. I'm kind of pretty excited this time around to actually be on the floor and practice my role as a nurse versus practicing as a student nurse, if that makes sense. So that is what to expect on your 498. In addition to your knowledge assignment, you have to do something called a knowledge check, which is just like a little questionnaire just to double check to make sure that what you know, or asking you, testing your knowledge of the week stuff, like, oh, how many hours is, or I don't even know, I haven't even looked at it. But there's something called knowledge checks for your 498 classes for your clinical. And, oh my god. And your clinical logs and your clinical checklists are due every 2 weeks. So week 2 is when it's due, week 2, week 4, week 6, week 8 is when your clinical logs are due. So you don't have to turn it in every week, it's just due every other 2 weeks. Now you guys may be like, what the hell am I talking about? Like, why does it feel so overwhelming? Because it is. I hope that I was able to kind of help you guys summarize exactly what you need to do, if that makes sense. But it's a lot of just self-reviewing. It's a lot of self-motivation this time around. It's not like you're actually preparing to take an exam like every single week. You're just kind of, you are taking an exam, but it's not graded, if that makes sense. But you still want to do good, because where you stand now is where you're basically preparing yourself for your exit exam. So I'm gonna start making more videos throughout the week, kind of doing more weekly vlogs, because I look back and I'm like, God damn, I freaking wish that I started making videos since like the very first term, because it would have been great to look back and see, you know, how it was. But if you are starting at West Coast, or if you're starting nursing school and it all seems overwhelming right now, just know that it's normal to feel overwhelmed. It's normal to feel like everything sucks and just feels like you can't handle it. But know that you're not alone. Know that you're not the only person that's ever felt that way. You just have to kind of take a step back, take a deep breath in, and tell yourself that you could do it. Make a game plan and then execute that game plan, okay? And it's just, looking back, you know, for almost 2 years ago, almost like crying every single week because I just felt so overwhelmed. It's worth it, okay? And I don't know if you guys need that motivation, if you guys need to know that like you'll be fine, you will be okay, you will be okay. Because I don't know, there's just times where I felt like I wasn't gonna be okay, and here I am. I'm almost done, and it's crazy to think that, I don't know, it's crazy. I'm just really excited to get on the floor and kind of see what I know and everything that I've learned and mush it all together and just be a nurse. That's crazy to me, but I hope this helped you guys a little bit. I'm gonna continue making, I will try to make weekly vlogs throughout this entire term, because it's like I'm at the end and I want to remember this, because this is the last time I'll ever be a student. Well, maybe not, but you know what I mean. And I hope you guys found this video helpful. Give it a thumbs up button if you guys would like to see weekly videos throughout my last nursing term. And thank you guys for watching.